So yesterday, we announced 93,662 total cases and 6,340 total deaths due to COVID-19 in the state of Michigan. We continue to pay very close attention to the overall trends in the data and watch very closely region by region. As I've said many times before, the spread of the disease varies by region. So I'm going to go through that again. So as of the end of last week, our data shows that the Detroit region has the highest case rate at 61 cases per million people per day. But as I've discussed previously, the case rate is largely driven in that region by counties outside of the city of Detroit. The Saginaw region has the second highest case rate at 54 cases per million people per day and has seen a slight increase over the past week. The Kalamazoo region has a case rate at about 50 cases per million people per day and has been declining over the past 2 weeks. The Upper Peninsula is at 47 cases per million people per day and has seen a slight decrease over the past week. The Grand Rapids region is at 34 cases per million people per day and has seen a slight decrease over the past 2 weeks. The Traverse City, Jackson, and Lansing areas all have between 20 and 30 cases per million people per day. The Jackson and Lansing regions have seen decreases over the past 2 to 3 weeks, while Traverse City has seen a slight increase. Our testing numbers also continue to look really good across the state. We now have a 7-day average of over 28,000 tests per day, and we're testing over 2% of our population per week, which is our goal. The percent of those tests that are coming back positive is at about 3.3%, and that's something that we want to keep watching and we want to make sure that it goes below 3% steadily. So when you're testing enough and only a small percent of those tests are coming back positive, again, under 3%, that's a really good sign that the spread of the disease is under control. We also know that many cases are still associated with outbreaks. We're seeing several outbreaks across the state in every region. Last week, our local health departments identified 85 new outbreaks that they were investigating. The most frequent settings for those outbreaks, those new outbreaks, were long-term care facilities, social gatherings, office settings, agricultural and food processing settings, and manufacturing. Our state and local health departments are working diligently to identify these outbreaks and to stop the spread of the disease. But please, everyone, do not think that you are somehow going to outsmart this virus. If you try to sneak and you have large gatherings and you're not wearing your mask, and you're not maintaining physical distance, there's a good chance that you're going to come in contact with someone who has the disease. And there's a chance that you can get the disease. And you can get it and you can pass it on to others. And if you're lucky, you get to keep your life and you don't die. But even if you live, there are many people who have long-term health consequences, problems with their brain or their heart or their lungs. And there are still some consequences that we're still trying to understand. This is not something that everyone is just bouncing back from quickly. So please be vigilant and take COVID-19 seriously. Contact tracing also remains a critical part of our COVID-19 response. So in the past 30 days, nearly 20,000 Michigan residents have been diagnosed with COVID-19, and state and local health department staff have attempted to reach out to over 90% of those people. We are aggressively reaching out to those contacts of those positive cases as well. Since early May, volunteers and paid staff have made over 100,000 phone calls to those contacts of positive cases. But we're still only successful in reaching contacts about 60% of the time. So again, everyone has an important role to play here. Do your part, and please tell us where you've been or who your close contacts are. And please respond when health department staff send you a text message or we call. This information is critical to helping to stop spread the disease, and all the information that you share will be kept confidential. I also want to briefly touch on vaccines. We are all hoping for a safe and effective vaccine that will protect us from COVID-19 and allow our communities to get back to some sense of normalcy. So vaccines typically take anywhere between 10 to 15 years to develop and approve through 4 phases of trials. We're hopeful that a vaccine will be widely available for distribution as early as next year. Efforts to develop a vaccine are being accelerated worldwide, including here in the U.S., and with the leadership of researchers even here in the state of Michigan. Right now, there are more than 135 potential vaccines that are being studied. 8 are in large-scale phase 3 trials already. We just need one of these vaccines to be effective and safe, so I'm really, truly optimistic. But it's important to note that creating this vaccine is just half the battle. The other half is getting it to the public in an efficient and timely manner. So we're going to be working with our federal and local partners to make sure that the vaccine is available and distributed appropriately when it does become available. And most likely, as with previous infectious disease outbreaks such as the H1N1 influenza, it will be distributed in a tiered approach, focusing on those who are most vulnerable and our most essential workers. In Michigan, we are going to prioritize making sure there is equitable access to the vaccine and that we eliminate as many barriers as possible, focusing on those who are the most vulnerable. And although we are anxiously preparing and awaiting a COVID-19 vaccine, something simple that everyone can do right now is get a vaccine against other vaccine-preventable diseases like the measles, the mumps, and the flu. Our lives and our livelihoods depend on everyone doing their part right now. And again, focus on simple things that you can control right now. Wear your mask, wash your hands, keep your distance, and please get your flu shot this fall. If we join in this together, I know that we can successfully beat this disease.